A very warm welcome. You're watching One India English with me, Anubhuti Gaur, and today is the World Mental Health Day 2020. We are all reeling under the coronavirus pandemic, and mental health is a very important issue right now as all our mental health has been impacted during this pandemic. The theme this year on the Mental Health Day is mental health for everyone, everywhere. And to hold this discussion, we are joined by Dr. Sumita Timari, who is a consultant psychiatrist from Mumbai. Thanks a lot for joining us, ma'am.
Thank you, Anubhuti, for having me here.
So we talk about the mental health. Of course, it has become one of the most crucial issues as we're all reeling under the coronavirus pandemic across the world. If we look at the theme this year, it is mental health for all, for everyone, greater investment, greater access. So how important do you think it is at this point of time to take this entire mental health issue seriously?
I think more than any time right now is very important. We see a lot of people who are really struggling to keep their jobs. People are losing their jobs. People are anxious over the fact there's so much uncertainty, what will happen in the future. So there's so much stress on people, on kids, on like across genders, across socio-economic class. So the theme is very relevant, the this year's theme. I mean, mental health should be available for all and should be affordable, you know. So yeah, it's really important.
So we talk about greater investment, greater access, mental health for all. And we know for a fact that during this coronavirus pandemic, somewhere down the line, the healthcare systems across the world stand exposed that we are yet far, far away from focusing on mental health, the kind of focus it actually requires. So you think that the countries across the world are really capable enough to put in those kind of efforts to achieve good mental health status of their country across the world?
Why not, Anubhuti? I mean, physical health has been given a lot of priority. Like we've seen across like so many years, we've just been hearing about physical health. But now we've had so many studies which have shown, be it cardiac illnesses or be it the outcome of surgery. If a person is more, mentally, if he or she is more optimistic, there's less anxiety. The outcome of surgery is better. Physical health is better in office spaces. If people are more at ease, if their mental health is good, the output is better. So I think it's high time people start investing in mental health and take it very seriously, because it's going to not just help people in general, but also I would say the industries and the offices, the office environment, and it'll help them work conducively and work happily, and the output will increase. So it's a win-win for everyone if you focus on mental health. And we've seen that thanks to COVID, telemedicine has really become the in thing. Like we've been getting calls from patients, there's online consultations and psychiatry, it's very much possible. So even people calling from remote places where internet facility is available, of course. So it's very much possible for everyone to access mental health thanks to telemedicine. So yeah, why not?
So, if we talk about greater investment, now we cannot overlook the fact that during this coronavirus pandemic, many countries have been impacted. If you look at India only, our economy has been impacted. So, do you think that this is scope when the companies are cutting down, they are laying off the employees? Do you think that kind of investment is really possible given that the economic challenges that countries across the world, especially India, is facing at this point of time?
I I don't I'm not very well versed with the economics and how it goes, the investment, the GDP of the country and all. But we know, Anubhuti, that we've never, like we as a country in India has never really taken healthcare seriously. I mean, you look at the previous budgets and you'll see how seriously we've been taking health in general. Mental health is probably last on that list of priorities. So I don't know about now, but yeah, we need to invest more in healthcare, in mental health. Yeah.
So, if you look at people, of course, this is a time when we are not really stepping out for other things. And even when it comes to the medical reasons, people are kind of avoiding going to the hospital because they're afraid of catching coronavirus and a lot of other reasons involved as well. So, at this point of time, the only way to reach out to a psychiatrist, to a mental health expert, is uh, through internet. So do you think that one of the reasons why people are more reluctant is that people prefer meeting someone in person when it comes to mental health?
I think it's the opposite. Like there's so much stigma attached to mental health. There's, when you're going stepping out of your house, people will ask you kahan ja rahe ho, and then
Hmm.
you'll have to tell them I'm going to a mental health professional. Now,
Yeah,
right now, they don't have to do that. They just can shut their door, and they just can dial up to a psychiatrist or place a video call, and
yeah,
that's done. So this, I think, because it reduces stigma. So I think people are preferring this more than visiting. But yeah, nothing can replace that, like a personal visit to a doctor. But
yeah.
having said that, I've seen the opposite actually.
Hmm.
I mean, people are more comfortable with the online thing because it decreases the travel time. They don't have to answer too many questions to their friends, to their relatives. So yeah.
So, as a psychiatrist, have you seen some sort of increase in the number of people that have reached out to you during this coronavirus pandemic, other than the normal times when there was no pandemic? Do you think that pandemic has somewhere made some difference to the way, to our approach towards mental health?
Uh, See, I'm in Bombay, and in Bombay, I can tell you that yes, people have. I mean, the instances of domestic violence has increased. The
Hmm.
incidence of, and there's so much stress that people are under. This work from home thing is really taking a toll on people. People have to do their household chores, and they have to also work, in their office work, and that has also increased.
Yeah,
Everybody who works in corporates, every patient of mine has told me that they are working 12 to 14 hours as opposed to 9 to 10 hours, which was a regular thing for them. So, and also because of, like how you mentioned about the economy shrinking, people don't know when they might lose their jobs. There's always this, like a sword hanging on top of their heads. They don't know what's
yeah.
going to happen. Then a lot of people are staying with their families, and it's a difficult transition after having stayed
Hmm.
alone for so many years. Now you're staying with your parents. It's a difficult time for parents as well as for their kids. So
Yeah.
people are having a hard time adjusting. So yes, they are facing a lot of mental health issues. So uh, I think in the metropolitan cities, and I'm sure even in smaller cities, people have felt the need to. In Bombay, I have been contacted by a lot of people, and especially youngsters, kids like 16, 17, 18-year olds. The number has jumped. It certainly has jumped. Um, yes, I'm sure even in smaller cities, they
Hmm.
felt the need. Some might also be contacting psychiatrists. So yeah, in this lockdown, I personally, and I'm sure other psychiatrists also, have
Yeah.
seen an increase in number of patients who require mental health services.
Well, also, of course, we cannot overlook the fact that there is a stigma attached to the entire mental health issues. People are very reluctant in even discussing it out in open with other people. So, if we look at that, how corporates can actually bring in that culture where, of course, we cannot overlook the fact that the employees these days in the work from home culture are going through a lot of stress because the workload has somewhere increased. So, do you think that will be very difficult for the employees to actually come out if the corporation actually brings in like a psychiatrist or some sort of service where the employees can directly reach out? Do you think that people will be some sort of, there will be reluctance from their side that, in the workplace to come out and say that, they have some mental issues or something?
I think shouldn't be an issue because when it comes to mental health services, there's a confidentiality that we maintain. So nobody's going to tell their employers that
Hmm.
your employee is suffering from so and so illness, or he or she's undergoing all these issues. So as far as that is concerned, that should not be an issue. In fact, the companies that I work with, one of the companies has as a part of their CSR, they have this. Uh, Incentive, if you may, for people working as their employees, that they're going to pay for a certain number of sessions. So that also encourages the employees to come to a psychiatrist. So let's say if they are paying for, say, whatever, let's say 5 sessions. So 5 sessions, you're doing it, it's not on you, it's on your company. So the company is taking, it's a way of the company to tell you that, listen, we are there, we care about your mental health also. So
Hmm.
that's, I think, a good thing. So that shows that the company, is not going to shun you if you tell them about your mental health problem, because they're paying for it, they're sponsoring for it, so they care about the mental health. So I think this is something that companies across the board can do. It's a good thing. It's a good initiative that's been taken by a few companies. So, and also, Anubhuti, I think somebody has to, like bring about the change. Now it's high time. Everybody
Yeah.
is suffering from. I mean, India. But yeah, the thing is that the number of people suffering from mental illnesses is very high, and psychiatrists are now available, and stigma, I hope, is decreasing, or I hope it decreases in the future, so that more and more people and organizations and these MNCs and whoever the office bearers, they realize the importance of mental health without really shunning people. Yeah.
Yeah, also talking about which is this year's theme, greater access. As a psychiatrist, what do you think are the kind of measures that the government or corporations or we as an individual can take so that we have greater access to mental health?
I think in the age of internet, it's very easy for you or me to just Google up things like we do for
Yeah.
every other thing. I mean, it's very accessible. If you Google psychiatrists near me or psychologists near me, like
Hmm.
Google will show you so many of them who are like probably living in just like one kilometer distance from your house. So that's the easiest thing that you can do.
Hmm.
Apart from this, you need to be aware about yourself. I think if you're feeling low
Hmm.
for longer durations, or if you realize that you're feeling irritable, you don't feel like doing
Yeah.
anything, your sleep patterns are disturbed, your eating habits are disturbed, or somebody around you, if be very vigilant about people around you. Let's say somebody in your family or some of your friends, they're going through a tough time, just give them a call, just let them know that you're there for them. So just being there for each other, and being vigilant about
Yeah.
yourselves and people around you. I think for, I mean, on a personal basis, I think that should be enough.
Yeah. So also talking about the entire mental health issue, of course, there are a lot of people who have been very strong mentally so far. But in this pandemic, if each one of us has somewhere, experienced a different sort of emotion. So how should one realize that whether what one is feeling is just because of the pandemic or just because of the current situation, or someone is actually facing some sort of mental issue which needs the help of a psychiatrist and not something that you just, heal yourself on your own.
So the easiest thing would be to just go and get yourself checked by a psychiatrist. That's the easiest thing, because they'll take a detailed history. We'll do some sort of examination, apply some scales, and we'll reach the conclusion whether you do need, treatment in the form of either medicines or therapy, or is it just a phase and only lifestyle changes can bring about a change in your mood. So the easiest thing to do is this: if you see any signs of depression in the form that the person is feeling persistently sad, they don't feel interested in activities that they previously used to enjoy, or if they are feeling suicidal, tell them to contact a mental health professional, right? Or if a person is feeling very anxious, like they're sweating, there's palpitations, they just say घबराहट होती रहती है दिन भर, they're not able to sleep, they're very restless all the time,
Mhm.
that's anxiety. Just they
Yeah.
so if they have all these things, they can meet a mental health professionals. A lot of people are suffering from insomnia these days. They're not
Yeah.
able to sleep, or they fall asleep and then they keep getting up multiple times during the night. So that's insomnia. So if you do recognize like major illnesses like depression, anxiety, schizophrenia, a person may become very suspicious, a person starts having hallucinations. So if these are these are some symptoms that I can just tell you in this interview.
Yeah.
Otherwise, if you come across all these things, then please contact a mental health professional. uh,
Hmm.
they're very nice people and they'll help you.
Yeah, of course, that is there. But also, one interesting question I just want to know from you, from somebody who's been treating patients all this while, have you experienced any kind of change in the pattern of the mental health issues that have emerged during this pandemic, particularly something new that you're seeing for the first time, or some sort of changes? If you see like the pattern of mental health issues, have they changed like during this particular time?
Um, I think the major things that I've been seeing, there's a lot of patients with anxiety. A lot of patients with anxiety. I mean, people who were uh, previously probably coping because they had the access to their friends, or they had access to theaters, movie halls, and other activities, are not able to do those things. So that is one. The other thing is the fact that some people are living all by themselves. They
Yeah.
don't have any house helps, they don't have anybody to actually help them, right?
Hmm.
There are some people who were, I won't say hypochondriacal, but some people who used to fear, mujhe kuch ho na jaye, something bad might happen to me. And now what has happened is, because of COVID, now they are so scared that some of them are not even stepping out of their houses. So that
Yeah.
has been sort of unmasked, you can say. It was always there, but till now they were coping up with it. But now
Hmm.
that's been unmasked. It's a full blown mental illness now.
Yeah.
So these are the things that I've seen very commonly. They've increased, yes, they have.
Yeah.
Yeah.
So we talk about that people face mental issues. Sometimes they go to a psychiatrist and they do not feel that they've been helped in the manner they were expecting. So what should a person do in such a way? For example, of course, mental health issue is something that you have to explain yourself to the psychiatrist also. What if the person is not able to understand your problem, or there is some communication gap of some sort? Then what should a person do in such a situation if he feels that despite going to a particular psychiatrist, that person doesn't feel that he's been helped in the manner in which he was expecting?
See, the thing is that even with my patients, I ask these patients that, what are you expecting out of
Hmm.
this session?
Yeah.
Because a lot of times the person comes in with a lot of expectations, and that's not really how mental illness works. That's not really how mental, the therapy or medicines, how they work.
Yeah.
So there's a lot of preconceived notions. So first we need to clear those out. So the easiest way would be very open with your doctor or your psychologist. Don't lie to them. Try and not hide things from them, because they're there to help you. Because a lot of times you'll try and you'll think that what if he or she judges me, but
Hmm.
the doctor is not there to judge you. So he or she is just there to help you. And if you feel that your whatever your problems were are not getting sorted out, either you tell this to your doctor. Maybe
Yeah.
you can work out things. Maybe he or she, the doctor, will clarify, that this is how things work, this is not how things work.
Yeah.
Or otherwise, of course, you can take a second reference. There's no harm in that.
Hmm. Of course. And also, I just want to ask you that many people feel that there is a stigma around taking medication to treat your mental issues. As a psychiatrist, how do you feel about that? Some people are not convinced enough that, they're not ready to take in the pills or any kind of medication, and they are very reluctant. And they think that only a session with the doctor will solve all their issues.
Yeah, I think we need to get over this. Like, it's been years now. People
Hmm.
take diabetes medicines, people take hypertension medicines. You have to take it throughout your life. And there are side effects to everything. But
Hmm.
I am telling you from my experience that people, I mean, antidepressants, anxiety medicines, bipolar medicines, schizophrenia, all the medicines that we have these days, they are wonderful medicines and they are very effective. And people who actually taken medicines will tell you this,
Hmm.
these medicines. And it's not like we're going to over prescribe medicines. People who need medicines should take medicines. Why not? It's an illness, it's a neurobiological illness. There have been studies, it's been shown, so why not? I think people need to get over this, we'll not take medicines and talk therapy. Okay, talk therapy has its own benefits, but a person who needs medicine.
Yeah. So if we look at India's healthcare system, we cannot deny the fact that it is not that robust. If you look into rural India, in rural India, people do not talk about mental health at all. It is a huge stigma. It is very difficult for people to even understand what is the entire concept of mental health. So how challenging do you think it is for psychiatrists, for doctors, for the government, or for the country to actually penetrate in the mental health into the rural India?
Yeah, I think there's a lot of education that needs to be done. Education of the masses that needs to be done when it comes to mental illness. People still go to, these faith healers. I mean, there's no harm, of course. You please go to your faith healers, but there are some things which are illnesses. That's why it's called illness, right? So I think there's a lot, you know, there's a lot of psychoeducation that needs to be done of the masses. But The thing is that there's this foundation, a close friend of mine runs this foundation, and she's adopted a village. And
Hmm.
she told me that she wanted me to come to her village because uh, there's a few people who felt suicidal there. So she recognized the need. And when she explained it to them, I think when people meet a doctor, they realize that, oh, mental illness is not just pagal ka doctor. That's
Hmm.
how people address psychiatrists in the country, sadly.
Yeah.
um, so the more you engage with people, the more they'll realize that, oh, this is not, we had some preconceived notions, because that's what's been passed down through generations. So I think engaging with people, having more outreach activities when it comes to mental health,
Hmm.
that's something that needs to be done, and I know that will take time, but let's hope that things become better.
Yeah, of course, these are very challenging times. These are totally unprecedented. And this has been elongated for more months than we had anticipated. That is one of the issues that people are really tired at this point of time, that when will coronavirus finally end? In
Yeah.
India, of course, the cases are becoming low, but yes, there's still a huge danger. We're still in danger. We're still not out of the woods yet. So, of course, it is very difficult for people. And also, now that we are seeing people around us, like in the vicinity, getting infected without even meeting anyone, it is even, creating a kind of panic that if the other one person can have it, we can also have it. And that is why most of people are confining themselves inside now. Of course, it has opened up, and yet we are kind of inside only. We are very skeptical about stepping outside. So if you look at this point of time, what, as a psychiatrist, what do you suggest to people to ensure that their mental health is good?
Um, I think stay connected with your friends. Have a proper schedule for the day, like the
Hmm.
time you wake up, the time you go to sleep, your eating habits. Keep yourself hydrated. Eat good food. Have I mean, plan one activity that you will do in the day, some form of physical activity. You love dancing, you dance. You love working out, work out. You want to go for a jog, go for a jog, because that is going to, naturally, it's going to produce something which is called as endorphins, which are your body's natural happy hormones. So that
Hmm.
is going to take care of your mental health. So I think that's it. And if there are any conflicts, try and resolve them amicably rather than fight over it, which is easier said than done, but then it's a matter of practice. So I think these are the basic things that everybody needs to care about
Yeah.
for their mental health.
Yeah, so what is your last message to all the people out there on this Mental Health Day 2020?
Um, so the message is that please don't shy away from contacting a mental health professional. It is for you. It is you will feel much better once you do contact a mental health professional and you see that so much stigma, it's just worth not worth the hype that it is.
Yeah.
And keep your eyes and ears open for your loved ones, for your friends. If you find anyone who you think is suffering from a mental health issue, please tell them to contact a mental health professional, and don't shy away from taking medicines. Listen to your doctor and take care of yourself.
Thank you so much. Thanks a lot for joining
Thank
us.
you.
And I hope that all those people who are watching this discussion, it was helpful. And take care of your mental health. And mental health is an important issue. Do not dismiss it as something that can be dealt with later. Stay positive, stay happy, and be there for each other. And keep watching One India English.